When we started this project and we started talking about how we were going to demonstrate the impact, we really struggled because there were really no standardized tools. We all looked at how are we going to measure that trauma symptoms are being reduced? How are we going to measure that this child is getting better? And we had a lot of philosophical conversations during our work with Innovation Network. What does that look like? What does that mean?
At the D. Norton Lowcountry Children's Center in Charleston, South Carolina, Executive Director Elizabeth Ralston says her center has already tried similar efforts on its own. This one, she says, was a wonderful journey.
In fact, we had 3 different efforts, and the result of those 3 efforts was not positive, and I will tell you that it caused me to have some concern about what a 4th effort might be. And the support that we got through the training and the guidance and the coaching has been tremendous, and we've accomplished it this time.
Children's advocacy centers across the country have been eager to hear more about the Duke Endowment's role in the project, which Dr. Ralston describes as a partnership that went beyond money.
We're hopeful that we'll be able to use a similar process with other large groups of grantees that we're going to work with over the next several years so that we can agree on common outcomes and common instruments to measure those outcomes. We feel like this process has allowed us to engage our grantees in a new way so that it's not the funder directing how things should be measured, because often the grantees themselves know how best, they know what's important and how to do it. So it allows us to engage in a conversation with them in a new way that we believe will give us a better outcome for us as a foundation in the years to come.
Today, most of the 32 centers say the initiative has helped them serve clients better.
We see lots of children, we deliver lots of services, and by doing good program outcome evaluation, we can know what parts of our program are helping kids, and we can know what parts aren't so helpful, and we can then use that to educate ourselves and to direct our decisions about what we are going to do.
In Hendersonville, Angie Alley believes the project has also helped the Healing Place tell its story to the community, a source of volunteer help and valuable support.
We put out an annual report to the community, and it goes in the newspaper. And during this process, I noticed that what I was telling the community really changed. Before I was telling them how many children we saw or how many children disclosed out of the public school system. Now I'm telling them how many children are entering into counseling and how many children's trauma symptoms are being reduced. Or I'm telling them how many families are following medical recommendations, how many families are following mental health recommendations. And that's very different than just telling them we have X number of children. It's X number of children are improving.